I'm thinking as I do 9 o'clock, my left hip bone comes up a little bit higher, my right one comes down, and then vice versa when I do 3 o'clock, the right one comes up a little bit, the left one drops. Okay, so do 12 o'clock, 6 o'clock, and then do 3 o'clock.
You can see how this is gonna arch my low back. Go within your tolerance. So if you don't feel enough, you can start pushing a little bit more, bringing the hands closer together. You'll feel more of a stretch here. The more further apart you bring your arms,
is that rest is one of the worst things that you can do the moment you are in a little bit of discomfort. Now, rest doesn't mean changing your activity slightly, meaning instead of doing a high intense interval training weightlifting class, switching to a little bit of cardio on the bike. It just means don't lay in bed and don't completely rest and avoid all your activities. It's very important.
What's really interesting is if you take an x-ray or an MRI and you put them up to a screen and then you ask a doctor which person has pain, you can't assume. It's almost a flip of a coin. Just looking at someone's x-ray, you can't determine if someone actually...
We'll begin by examining the connections between stress, pain, and our thinking. Now, when you're in pain, probably the worst thing that you can hear from someone else is that it's all in your head. And that's absolutely not true. Your pain is real. Interestingly though, recent research has shown that the amount of physical damage to the body doesn't actually correlate with the amount of pain that a person feels. Some people are able to mute those pain signals so they feel less pain. And while we might think that these people have just been born with this ability, the truth is that many of them seem to learn it through life experience. People like athletes, people who do physical labor, and people in the military all develop